Good morning. As you know, last night we announced the University of Texas at Austin will be extending its spring break for 1 week in response to the spread of the COVID-19 virus. This decision was designed to give our community additional time to prepare as we implement new strategies for the health of our students, faculty, and staff on our campus. We believe we're taking a measured and reasonable approach to protecting the public health of our community, which is about 70,000 people, and also the education of 50,000 students, including 10,000 of our students who expect to graduate this May. And these measures, which we will continue to develop over the next 2 weeks, when the university will remain open, so our faculty and staff can prepare to increase social distancing measures on campus. These measures include working to shift many of the lectures to online instruction, reconfiguring classroom space and developing alternative instructional modes for classes that must continue to meet in person, things like science laboratories, performing arts studios, studio art, and updating our practices in the residence halls, dining halls, recreational facilities, and libraries to reduce unnecessary contact and promote better personal hygiene. Our plan is for the students to return to campus on Monday, March 30th, a little over 2 weeks from now. We recognize that these changes are very disruptive to our students and faculty in the middle of a very busy semester of learning, research, and discovery here on the 40 acres, but we are also mindful of the very serious public health concerns and the health of our community. Before I take questions, I want to make a few announcements. As of today, the university is suspending university-sponsored travel for faculty and staff, our employees. Business travel through April 30th will be suspended. That's domestic and international. And for student travel under university programs, we're suspending international travel through the summer. We are suspending campus visits, the admissions welcome center tours, and in-person admission events for the time being, including for prospective and admitted students held by the UT colleges and schools until further notice. And in place of these live experiences, we will soon be announcing a number of online and virtual options for prospective students and their families. We are canceling events in the Bass Concert Hall for at least the next 2 weeks, beginning this evening, and similarly for the Irwin Center, canceling the events in the Irwin Center for the next 2 weeks for the time being. COVID-19 is a very serious public health concern, and the situation is rapidly changing here locally and across the nation. We continue to monitor the situation. We feel these are the right measures at this time, and we'll continually evaluate our plans as the situation does change. So I'm glad to take your questions now. Yes?
I think it's safe to say that plan UT is going to implement isn't as radical as the steps that some other universities have taken. Can you speak about why this is the plan specific? You're not sending kids home, you're not shutting the campus down. Can you talk about the logic behind that?
So for many of our students, this is their home. This is where they live. This is where they work. Many of our students work, which is important for their financial aid and for them to live. We have 10,000 students who expect to graduate in May. These are students who are going to go on and contribute to society, and interrupting that graduation and interrupting getting a degree from the University of Texas, we think has tremendous consequences on a large number of students. So we are trying to balance these two factors.
In terms of the international travel, does this mean students who are studying abroad now are going to have to come home? You're going to bring them back?
We have already recalled all students traveling who are internationally on university-sponsored programs.
And then a follow-up, I know a lot of times when students study abroad, they sublease their apartment or something if they're older, and so is there going to be housing when they come home?
We're working on all those details. We expect it's about 700 students who we are now recalling. In total, we had recalled about 100, and I don't remember the exact number, 175 had already been recalled from China and Italy and a few other countries. We're going to work with those students as best as we can.
President Fernandez, so with this 2-week spring break, if a student is traveling, say, for the original week, the first week, and they still have to then come back to campus and stay in their dorms, how will minimize, their risk? Will you be testing them depending on where they went during the first week?
So residence halls will be open on March 23rd, which would have been the normal resumption of classes. They're actually open during spring break for students who actually don't have a place to go during spring break. And so we'll be putting measures of social distancing in the residence halls beginning immediately as soon as we can implement those.
Are canceling classes and moving all classes online, is that still on the table if this does get worse?
We are going to continue to monitor the situation. It's rapidly changing. The decisions we made Tuesday are different than the decisions we made on Wednesday, and so we're going to continue to monitor the situation without making any projections or predictions of what those would be.
For students, for classes that can't go online, like you're talking about
Right.
performing arts and labs, what do you mean when you say reconfiguring classrooms and finding alternate rooms?
Yeah, so a reconfiguring classroom, so there might be a laboratory class with 15 students, and so maybe it needs to meet over 3 time periods with 5 students apiece so that they have the proper distance between them and proper cleaning and so on can take place. So that's one example.
And a follow-up, if I can?
Yeah.
So how are you planning to accommodate students who at home they don't have Wi-Fi or computers?
There are going to be lots of accommodations we're going to be needing to make for health reasons, for technology reasons, and we're going to try as best as we can. Now, the reality is most students are using technology already. Almost all our classes have some technology component to it. The libraries will remain open, our study areas will remain open. The campus will remain open with Wi-Fi. That's one of the reasons we don't want to close the campus. But we will have the social distancing guidelines in place in all of those locations.
With the Urban Center, so I saw in a different announcement that it was all upcoming events have been postponed, but you said 2 weeks.
So this is rapidly evolving. Right now, we're looking at a 2-week period. We have to work these details out, and it could change on Monday. But right now, for the next 2 weeks, if you are planning on attending an Irwin Center event, those are going to be rescheduled.
Got a clarification on the decision on going online and then follow-up.
Mhm.
It's not mandatory for the professors to do it online, is that correct? It's up to them, it's their call?
I'm going to turn this over to Provost McGinnis, who is working out the specifics in our 16 schools and colleges with literally thousands of courses about how we're managing that process. Provost McGinnis?
Yeah, so we're working very closely with the academic leadership in each college and school. We have such a wide variety of the kinds of classes that we offer. So a good example of a class and course credit that can't be moved to online is a pharmacist who's currently in a clinical placement and needs those clinical hours in order to be licensed as a pharmacist and to be able to graduate. So we can't have a blanket statement that says every course has to go online because we have too many things that cannot be delivered in that modality. We will make sure that the social distancing in place ensures that our community is safe, and we therefore work through it course by course by course. So if you're teaching a 500-person lecture in an auditorium with 500 seats, yes, it will be mandatory that that class go to an online format because there's no way to have social distancing in that sort of room. So we're working it through, and that's part of why we needed the additional time because we have about 10,000 classes on this campus, and we have to figure out the right modality for each one.
In regards to the events, mass, Irwin Center, for individuals who have tickets, for Aladdin, are we going to get refunded?
The Texas Performing Arts will have a policy on how they're going to handle it. I can't speak to that right now.
And what about baseball?
This is, again, a rapidly changing situation. The baseball games were going on with no fans, so we weren't having fans coming in, at least for the next week. And so we will continue to make decisions on athletic events. And that's going to be somewhat related to the Big 12 decision on the basketball tournament, what the NCAA decides to do for its basketball tournament and other championships and other games. So that is continuing to evolve.
President Fennes, will the students have to make up this extra week at the end of the semester?
Do you want to answer that
Yes.
question?
We are currently not planning to extend or change the calendar in any way, and we are asking the faculty as they look at their syllabi and think about how am I going to deliver the rest of the semester, how am I going to make up for that lost class time. So each faculty member will be working that out inside his or her class.
And also, do you have any idea at this point how this will affect graduation? Will it still be able to happen at the planned time?
So let me separate the issue of graduation, which is a student receiving the degree because they've met the credits and requirements of the program. Our goal is for all students who, this is their last semester at the University of Texas, our goal is to have students complete those degree requirements this semester, get officially certified as receiving that degree from the University of Texas. A different question is, are we going to have the commencement ceremonies? We have a lot of commencement ceremonies for departments, schools or colleges, and then of course 25,000 to 30,000 people out here on the main mall for university commencement. That's a month and a half away, and so we're not prepared to make those decisions at this point about the commencement ceremonies.
Is there a significant cost to moving a lot of these classes online? I know there's been talks of a contract with Zoom, right? Do you have any ballpark figures on how much this is going to cost the university?
Let me answer that question in general. Everything we're doing with these changes has a cost to it. It has not been a factor in any of our decisions. We are going to bear the costs to make the changes that we need to do, whether it's the academic mission, continuity of research, accommodations for a variety of reasons. So we are really not thinking too much about what the cost is, but obviously there is a cost to each thing. So maybe to answer the question specifically.
And I'll just say very quickly, we were already working on our contract with Zoom, so that was already part of our planned tools that we wanted to make available to campus for education, for research, for meetings, et cetera. All we did was expedite that contract so that we would have it fully ready to use now.
I have one quick question and then I'll follow up about travel. So first, quick question, have you guys started taking any steps like actually disinfecting buildings or chairs, tables? Have you started that process? Or is there a need to?
So we have started that process. So the campus operations is looking at what is the right guidelines for cleaning for all our buildings. Now we have a lot of buildings and a lot of surfaces, so that's another reason for the 2-week period to make the adjustments. So it includes hygiene and cleaning.
And with traveling, can you explain why you went ahead and canceled those summer abroad programs too? It's still
So this is for students going on university-sponsored international programs because it's a practical reality. They're making those decisions right now about whether to travel internationally, sign up for a program. They have to put deposits down. And we felt there's so much uncertainty that it's better to have know they're not going to be able to do the travel, look at other summer programs that they can use for their credits if they need it, and make those plans now as opposed to deferring that decision and possibly having to cancel them at a later date where it's much harder to change.
What are the leave policies in place for faculty and staff, and will the work schedules of like maintenance workers, janitors, groundskeepers, will that change?
So we're working with our Human Relations Department on all our policies as a state agency, federal requirements. We're working with all our units on flexible work options for faculty and staff who need them. That's a standard process we have in any event. It'll probably be more broadly used. So we feel we have all the policies in place. We're going to have some training with supervisors about how to interpret them in this circumstance. But we think we have the policies in place to implement those.
Henry, since you're going to keep the campus opens and the dorm rooms open, your advice and your recommendation for the kids who may be going off for spring break, going home, do you want them to come back or do you want them to stay home for the second week?
We're leaving that to the students. As I said earlier, some students don't have anywhere else to go on March 23rd, so the residence halls will be open for them. If there won't be instruction over that week, so students don't have to be back. We're going to use that week to prepare these alternative delivery mechanisms. So we're not recommending to students one way or the other. We wanted to have them make those decisions and give them the options.
All right, we'll take a few more
Hello.
questions in the back.
Are what other universities doing, not only in Texas but around the country, is that impacting your decisions in any way, or is it just, something that maybe informing, how to go forward?
Well, we have been looking at these issues for several weeks now as the COVID-19 virus has spread, developing contingency plans and planning. And we feel that this is the right approach for the University of Texas right now with the information that we have. And we feel, as I said, it's a balanced approach which recognizes our responsibility to students and their education and also our responsibility about their health and the public health.
What are we doing for students who feel that they might have some of these symptoms, just from a health standpoint?
I'll ask Dr. Hines to answer those questions, because I am a doctor, but not a medical doctor.
We have testing capabilities. Where are people going for testing?
So for students who have questions, concerns, think they may be sick, we invite them to contact University Health Services, the nurse advice line. We discourage them from showing up first. We want them to call, let us know their situation so we can advise them on the best way for them to access our care. Sometimes that's coming to the clinic. Sometimes that is staying at home and exercising self-care. In terms of testing, that is very limited at the laboratory level. So in order to sort of qualify for a test, because they're sort of triaging their ability to process those tests, certain criteria have to be met. So we were not doing routine testing of asymptomatic individuals, for example.
So students and faculty who have to come back by March 30th, do you know how many are impacted by that? And when they do come back, how will you ensure that they are actually self-quarantining, and how will we make sure that, if they do need testing, they can get the resources that they need?
So there are a number of processes that need to be implemented. So self-isolation, that's you stay away from other people as opposed to self-monitoring. And really, I think that's a good advice for all of us, regardless of a travel history, is to know what your symptoms are if you have them, maybe check your temperature on a daily basis. And then if you do develop those symptoms, to contact your healthcare provider. For students, that's University Health Services. In terms of kind of tracking people, certainly those who have been on university business, through Texas Global, through Student Emergency Services and UHS. We're aware of those, and we've been communicating with those individuals. For those who have been on personal travel, we are requesting that they register through an online portal, and then communicate back to us, certainly if they are doing that self-monitoring and they do develop symptoms, and then we'll advise them from there.
All right, last couple of questions. Lauren?
The students who are employed on campus, is there any policy regarding their employment? Will they continue to work on campus? Will student work be suspended for the next 2 weeks?
So our goal is to continue campus operations, including student employees. And that's one of the reasons we're developing this approach, because for many of those students, that is their income. That's what they rely on to pay for food and for housing. And so subject to the social distancing requirements, the flexible work options that we are developing unit by unit, yes, we intend to maintain student employment.
Okay, last.
Is there a point at which you would transition to online only, or is that not on the table at all?
There's a point that we would transition to total online learning where it's practical. We expect after March 30th, most of the all the large lecture classes and many other classes will already be online. We're not ready to make that decision to suspend all in-person classes with social distancing, but we are going to continue to monitor the situation.
All right, thank you very much.
Okay, thank you, everybody.